Hi, I am Dr. Arsalan and today we are going to discuss an infectious disease, the typhoid, which has ravaged the humans for centuries. It's highly infectious, bacterial and contagious disease, and in today's lecture we will define the typhoid, its transmission, its causative agent, sign and symptom, diagnosis, treatment as well as the prevention will be discussed in this lecture. So first of all we will define this disease. It's an acute bacterial and contagious infection because it's spread through contact. Contagious means we spread through contact. It's characterized by high-grade fever and intestinal ulcers. Therefore, this typhoid is also called as enteric fever because it affects intestines and is characterized by the high-grade fever or intestinal fever. The causative agent or etiology of the disease is Salmonella enterica and Salmonella typhi. These are also called as enterobacteria because these infect the intestines. The bacteria was named Salmonella after its discovery. He was American veterinary surgeon Daniel Elmer Salmon. So this bacteria is named after this American veterinary surgeon Daniel Elmer Salmon. The Salmonella bacteria is characterized by rod shape because this is a bacillus. It is peritrichous. Peritrichous means that the bacterial cell has flagella all around its cell. So this bacteria is flagellated and motile. It is non-spore forming, and the most important, it is gram-negative bacteria. Also, it is facultative anaerobic bacteria. Facultative anaerobic means that this bacteria can produce ATPs or energy in the presence as well as in the absence of oxygen. In both of the circumstances, this bacteria can survive. So this is called the facultative anaerobic bacteria. Now the transmission of disease, it is transmitted through orophycal route. The infected person shed the bacteria in feces, and through these feces it is transmitted through orophycal route. It's a common observation that it can be transmitted through 5 F's. 5 F's. The feces, flies, fomites, fingers and food. So these make the 5 F's: feces, flies, fomites, fingers and food. Here a term fomite is used. Fomite means the non-living object which can transmit the infection or pathogen or play a role in the transmission of the infection. For example, utensils, cloths, furniture, towels, soaps, laundry or any of the object which can transmit this pathogen is termed as fomite. Now the clinical signs as well as the stages associated with the typhoid fever. There are 3 stages of the typhoid, and each stage lasts for 1 week. Now we'll discuss the clinical sign of the typhoid fever in each stage. The stage 1 is characterized by fluctuating fever, as it is the initial stage and just inflammatory condition has started. So there is fluctuating fever which is rising subsequently. Bradycardia or slow heartbeat. Malaise or dull body situation. Malaise means dullness. There is cough, headache, abdominal pain and discomfort. If you go for CBC or complete blood count, there is leukopenia. Leukopenia means overall decrease in the number of white blood cells, decreased WBCs. And lymphocytosis, in which the lymphocytes have been elevated or increased. So subsequently in the next week, the stage 2 starts, where there is fatigue in the body, high grade fever of 104 degree Fahrenheit, bradycardia and delirium. Delirium is the acute confused mental state. So delirium, acute confused mental state. So this shows the nervous signs. Therefore, it is also called as nervous fever. So the typhoid is called enteric fever, intestinal fever or nervous fever. Also in this stage, there are hemorrhages on the abdomen associated with diarrhea or constipation. Abdomen is standard, and there is splenohepatomegaly or inflammation of spleen and liver. And rattled breathing sounds are produced, which is the characteristic feature of the lungs abnormality. Then stage 3, high-grade fever of 104 degree Fahrenheit persists. There is dehydration due to diarrhea, muscle rash, fatigue due to loss of energy, and there is anorexia or loss of appetite due to high-grade fever because the enzyme of digestive tract does not work properly. Serious intestinal hemorrhages are seen, which is also called as Peyer's patches. This is the characteristic feature of typhoid fever. And there is thrombocytopenia, a decreased number of the thrombocytes or blood platelets. As the platelets drop down, So hemorrhages starts because we know the definition of hemorrhage, that it is the leaking or seepage of the blood from the blood vessels due to abnormality in the blood clotting or thrombocytopenia or deficiency of the blood platelets. Now the diagnosis of typhoid, the first one is Widal test comprising the antigen antibody reaction, but its efficacy and validity has been compromised efficacy due to false positive results. So now the practitioners and clinicians, they don't recommend the Widal test. It's better to go for stool culture for the culture of the feces on selective media for detection of the Salmonella colonies. Or Typhidot test. This is a rapid kit test. Then the treatment of typhoid, as it's a bacterial disease, so antibiotics are recommended, and the most common antibiotics in use are ciprofloxacin in oral form or ceftriaxone in injectable form. And in case of multi-drug resistant typhoid, where the antibiotics are not working, the clinicians recommend the use of azithromycin. It's a safe antibiotic and also can be used for a long time. Along with the antibiotic, you should go for the symptomatic therapy to relieve the symptoms. For example, there is high-grade fever, so antibiotic or anti-inflammatory recommended. In case of diarrhea, the oral rehydration salts or the fluid therapy is recommended. And in case of respiratory tract infections, the antitussives are recommended. The most common complications associated with typhoid, if left untreated or not properly treated, it causes the bronchitis, pneumonia, and sometimes the encephalitis. And out of these three complications, the encephalitis, it is the most dangerous and fatal one and may lead to the death of the person. Now the prevention of the typhoid. The best tool for prevention is the vaccination of the population. And typhoid polysaccharide vaccine has been recommended by WHO. World Health Organization has recommended the use of typhoid polysaccharide vaccine. And these are made available by different brands. For example, the Typhi, it's prepared by Sanofi, or Typhirix by GSK, GlaxoSmithKline. These vaccines, Typhi and Typhirix, are commonly available in the market in Pakistan as well. So this was all about the typhoid. Hope you have learned something new in this lecture. Keep watching my videos. Thank you.